Well, today is World Mental Health Day, and it's an important part of an effort to promote efforts across the globe, really, to protect and improve mental health. And joining us now live to talk about it is Dr. Jeffrey Guinna, Chief Medical Officer for Easterseals, MORC. And Doctor, if we could start, it seems like there is a constant stream of really difficult news and events tied to declining mental health. Why is it more important than ever to maintain positive mental health?
Well, I think you're right. Unfortunately, in the last few years, with all the stress related to COVID, whether that's fear and grief, or whether people losing their jobs, or being unable to socialize, engage in the activities they normally like to enjoy, we've seen huge increases in suicidal thoughts, suicide attempts, drug and alcohol use, and overdoses. And so now I think is more than ever, it's important that we're paying attention to our mental health.
Well, I know it's gotten better over the years, but there is still a negative stigma about getting help for mental illness. Why do you think that is, and what can be done about it?
Well, I think there's a self-stigma, people thinking, I can, if I go and talk about my problems, or if I seek help, that somehow I'm weak. And I like to think about myself as a strong individual. There's also societal stigma and people fearing, what would others think? Could I lose my job? Would people still see me as a good person or as reliable? And I think it's really important that people know that if you seek mental health treatment, that's confidential, and that there are people that are ready and willing to see you and provide to a listening ear and non-judgmental interventions to help with whatever you're dealing with.
Well, MORC, by the way, has that free anonymous online tool for people looking to do a mental health screening. Can you kind of talk about the process and how it works?
Sure. Easterseals Morc has a what we call the checkup from the neck up. And if you go to our website, it's a free anonymous tool, so we don't collect any information on anyone. We don't ask for your name. And there's various different screenings depending on whether you're concerned about depression, anxiety, just general well-being, drugs and alcohol for yourself, or maybe your child or a loved one. It takes tops 3 minutes, and at the end it provides you resources both at Easterseals Morc and at other local and national resources that you can look into on your own, no obligation, and see if something can help you or your loved one.
Well, could you give us some examples of some of those resources that you provide to people?
Sure. At Easterseals Morc, we have psychiatry medication management. We also have psychotherapists who are doing one-on-one therapy or group therapy. We have peer support specialists who maybe have been in recovery or in remission themselves with a variety of mental health concerns. We have specialized services, whether it be for depression or anxiety, or schizophrenia or bipolar disorder, autism, intellectual disabilities, really the full gamut of mental health.
And again, can you give us the website so that we know where to go to do that check?
Sure. Go to eastersealsmichigan.com. And there are a variety of resources on there, but the checkup from the neck up is right there in the front.
Well, Doctor, we appreciate your time. Some really helpful advice as we try to push for more awareness for mental health. And we'll be back in a moment.
Thank you.